Well, a major new healthcare alliance was announced this week in Indiana. Community Health Network and Wishart Health Services forming a new operating partnership that will create the largest primary healthcare provider in the state. Barbara Lewis sits down with the leadership of the two healthcare providers in the business of health. Barb.
Gary, thank you. The new Patient Health Partnership is designed to withstand the impact of the federal government's Affordable Care Act. Here to talk about the reasons behind the deal and its impact on Central Indiana is Bryan Mills, the CEO of Community Health Network, and Matt Gutwein, the CEO of Health and Hospital Corporation of Marion County, the corporation that oversees Wishart Health Services. And welcome to you both, and congratulations.
Well, thank you for having us, Barbara.
Well, Bryan, let me start with you. Because of the overall impact that this operating partnership will have on Central Indiana.
Barbara, I get excited when I talk about this because I think it does have a huge impact. What we envision is that we can combine our systems. I mean, our systems are going to be independent. This is not an asset merger, but we're going to run them as one. And so therefore, we both have very large primary care networks, very large behavioral care networks. And you talked about health reform. It's here. I mean, we know it's coming. It's live 1/1/14. And so all people, and it's not just for a segment, but all people will have a greater access to health care. So if you come to any of either our systems, you'll be in one system. And so we'll have greater access, better navigation, better ability to get you through a system, hook you up with whomever's responsible for your care, and therefore avoid emergency room visits and other places that people have impediments to their care.
Well, Matt, do we really know the impact of the Affordable Care Act yet and what you're planning for?
Well, we certainly know a lot. One of the things that we know is that there will be more health care coverage for Hoosiers across the state. And our experience from every other state that has expanded coverage is that that will place greater demand for care on all of the healthcare systems. So by Community Health Network and Eskenazi Health partnering, we'll be in the best possible position to help with that demand and make sure that we have more access, more availability, more quality. But even more important than that, we know that healthcare reform is going to demand, and I think rightfully so, greater integration and coordination of care. And by working together, by partnering, by cooperating, by collaborating, we'll be able to provide that level of integration that ultimately results in better care for the patients, more options for the patients, higher quality, and lower cost for our entire community.
Okay, so you'll be the CEO, Bryan, of this new entity. What are the next steps here then?
The next steps are us coming together and putting together our team to identify what are the complements that we have right now. We do some things that they don't do. They do some things we don't do. How do we make sure those are coordinated? Where we've got services that we both do, how do we make it one in the patient's eyes? Because to the patient, they don't care what systems we're on. They don't care whose doctors are on what staff. They want access. And so we create a system that avails both of us. And our markets don't overlap very much. They're very complementary. So our purpose is to develop the system from the eyes of a patient, the patient's family, to make sure they know how to get in and how to get through the system. Okay.
And Matt, we always think of Wishart as the entity that's really affiliated with IU Health, but yet you're partnering with Community. And it seems unique to us from the outside.
Yeah, well, we have a lot of wonderful partnerships. We are so grateful for our partnership with the IU School of Medicine. That is a partnership now that I think is in its 103rd year. And we have benefited so much, and we believe that this partnership will only help our long-standing relationship with the IU School of Medicine, but also with so many other partners we have. You know, we actually partner for education, training, and teaching with over 40 institutions around the state of Indiana and the country. So IU School of Nursing, IU School of Allied Health, the IU School of Dentistry, Butler, Ball State, Marion, Taylor, I could go on, Purdue. And so this is a way for us to be able to be best positioned for healthcare reform so that we can continue to play this vital role in the training and education of tomorrow's healthcare professionals and workforce.
Well, best wishes to you both. Congratulations.
Thanks for having us.
Thanks, Barb.
Gary, back to you.
Another major announcement this week, Community Health Network and Wishart Health Services announcing a huge partnership, really a landmark partnership that some think can be replicated perhaps by others around the country. Healthcare reform really driving this partnership, and Indiana or Indianapolis has the potential of being kind of a leader in this review, in this part.
Absolutely, and I think from a health system perspective, they've done an incredible job of leveraging public and private partnerships and looking for ways to grow as they're also consolidating.
But what you see here is a consolidation. This is not a surprise. We've seen it in the healthcare industry. It's going to continue. It's the result of the legislation in Washington. We will see more consolidation.
Oh, I just applaud them for getting together. This is the new healthcare. This is the new future, and we better get out in front of it. And I think they took a great step.
Yeah, and the entities involved, communities partners, Wishard's partners, whether it's IU and the others, are really big.